So good evening, everyone. We are just about to start the webinar. Good evening from India, Dr. Jason.
Yeah, and in fact, good morning to Dr. Jason. And maybe you can, if we are audible, you can switch on your camera so that we can see you. We are actually longing to see you from a long time. Yeah, hi. I think you are on the mute. Yeah, mute mode.
Sorry, it's a good morning, at least morning.
Yeah.
Good morning here.
Yeah, I think.
So good morning to you. Good evening to all the delegates who have joined from India. And this is the session which we actually were waiting for a quite long time. We had a short 5-minute delay, so just cover up some technical lag in our conference room, which we're covering it up. I suppose everything is fine now and we are good to go. So first of all, welcome, Dr. Jason. Thanks for accepting the invite and making yourself available for such a wonderful topic for webinar from IFA.
In fact, this is a very wonderful topic where we were looking for this topic because this time now the time has come that we really need to emphasize on quality controls if we want to improve our success rate, and not only that, we want to get rid of infections, we want to have a better embryo quality. We need to see the quality checks, quality parameters to attain that. So maybe, yeah, Dr. J, you can start. Yeah.
Okay. And who other better than you to actually discuss on this particular topic of QC in lab, with so many papers being published exclusively when it comes to culture conditions, aneuploidies, droplet culture, pH, and all the stuff. We have been reading your papers since long ages. And I think one of your paper, which was just pre-COVID, that is controversies in ART, did actually made a lot of hype and actually led to the importance of QC in the lab and helped a lot of embryologists to understand those topics in details. So with that, I think I'll just
I think you can just brief a bit, because although it doesn't require any introduction, but Naval, I think okay, let me brief a bit about him. So Dr. Jason, so, and as we all know that he is the Chief Laboratory Officer and President of Lab Operations at CCRM IVF Laboratory Network. So Dr. Swain, as Adjunct Clinical Associate Professor in Obstetrics and Gynecology at Rutgers University, as well as at University of Minnesota. So today he has to his credit more than 45 peer review articles, and not only that, he has contributed to ASRM various committees, served in various committees at ASRM, ASHRAE, PCRS, and other organizations focused on assisted reproduction. So collectively, we can say that he has done extensive work in the field of reproductive technologies, and today we are fortunate enough to listen to him, what he has to say, with whatever he has gathered out of his expertise, his so many years of hard work. So over to you, Dr. Jason.
Thank you very much for that very kind introduction. I'm going to try to share my slides here. All right, so hopefully everybody can see those slides and hear me okay. So as mentioned, very important topic for what we do as embryologists. Going to be discussing quality control today. And really, it's a very broad topic. We could spend many hours discussing this, but we're going to try to highlight just a few key points of really what every embryologist should know, and things that really come up every day in the lab, and really these can be the cornerstone of a good laboratory with high functioning, high rate outcomes and lower quality laboratories.
Excuse me, Dr. Jason, sorry to interrupt you in between. I think you are in presenter mode. The slides are in the presenter mode.
Okay.
Yeah.
Is that better?
No, still it is in the presenter mode.
Yeah, we could see the notes section also. It's not the proper presentation. It's
yeah. Let me figure out what's going here. Better?
Yeah.
Perfect.
Yeah.
All right. Sorry about that. So this should look familiar to all of us, especially those of us who are lucky enough to be in a newer modern IVF laboratory. But this is a pretty fair representation of a modern IVF lab. So you can see that they've used proper building materials, stainless steel, rolled vinyl flooring. They don't have particle board or laminate items that could be giving off VOCs or other harmful compounds. You can see modern benchtop incubators. You can see med gas on the wall there, presumably with low oxygen culture conditions. You can see in the ceiling HVAC system, so they likely have centralized air filtration with HEPA and chemical filters to help filter out VOCs. Stable tables, ICSI setups, very modern equipment, very nice, clean, efficient IVF lab. So this really is one of the starting points of achieving high outcomes. And it's really important to have the right tools, but more importantly, you need to, as an embryologist, use those tools appropriately. And this really becomes important when you consider that we've just highlighted a few key factors inside an IVF lab, but it's been estimated that there's over 200 variables inside the IVF lab, which could impact embryo development and IVF outcomes. So it really starts to paint the picture of how important every little thing that we do in the lab can be to achieving those high outcomes. And so that then leads nicely into quality in the IVF laboratory. It really is up to us as embryologists to help monitor and manage those over 200 variables if we want to create the optimal environment to grow our cells. And so really, I always highlight this particular publication or one of the more recent versions from David and Sherrod Mortimer. They literally wrote the book on quality and risk management in the IVF laboratory. And so there are some key fundamental aspects that still hold true today, even though this book has been out for many, many years. That really should be required reading for the embryologist. And many key points in there, but when it comes to quality in the IVF laboratory, sort of narrowing this down for the limited time we have for today's lecture, is we really need to measure, monitor, and track various endpoints in the IVF lab. As we mentioned, there's over 200 variables that can impact embryo development outcomes. And so we need to make sure we understand what those variables are and that we're measuring, monitoring, and tracking those. If we don't do that, we can't accurately or regularly identify a possible issue if there is a problem in our culture system. Going hand in hand with that is we really have to make sure we document this measuring, monitoring, and tracking. It's sort of an old saying in the regulatory world when we have our inspections here in the US that if it's not documented, it didn't happen. We all may think that we have very good memories. Our memories are not as good as we think they are. So you really need to have documentation of the things that you're assessing to show that you're assessing them, to show a record of how those may be adjusting or changing over time. And then importantly, that you're documenting any corrective action that you've taken to show that you've addressed the potential issue. And so what we'll talk a little bit about in these remaining slides is what should we be assessing or monitoring or measuring in the IVF laboratory? And the simple answer is, well, most things. There's over 200 of them. Certainly some are going to be more routine than others, and those are going to be the ones that we focus on today, those that tend to be most impactful or most problematic, and that should be a routine process for us in our labs. Another question that comes up often is, when should we be doing this? And the answer to that is really, it depends. It depends on what the endpoint assessment is, but it really needs to be on a regular basis and done routinely. Set a schedule and adhere to that schedule. And the when may depend on the particular endpoint. Could be daily, could be several times a week, could be every month, could be once a year. So it'll vary on what you're measuring. And then finally, one of the more important things that comes up and that I really like to stress is the question comes up, well, who should be doing this? We're all busy. There's not always very many embryologists in the lab, especially if it's a very busy lab. But the answer is everyone needs to be involved in this process. That's the only way you can create a comprehensive quality management system in the lab. Is it shouldn't be relegated to the most junior person on staff or a lab assistant to be doing morning measurements of temperature or pH or whatever it is. Every embryologist needs to be involved. That's how you learn, that's how you grow, and that's how the entire team sort of takes this quality and risk management approach. and makes you better able to identify potential issues. And presumably then part of that embryology training is to make sure that every embryologist understands how to respond, how to react, how to correct whatever those issues that be. So it really is a team event, so to speak, when it comes to quality in the IVF laboratory. So for the purposes of today's talk, we're going to be mentioning quality control specifically. And so this graphic sort of nicely summarizes the relationship between the quality management system and the specific topic of quality control that we'll be discussing today. And in summary, quality control, or QC, really is the inspection phase of the quality assurance program of the larger quality management system. And to put it in layman's terms, it's sort of the monitoring phase when we're looking at equipment monitoring and functioning, looking at other environmental variables, consumables, technicians, and other endpoints. And so those are going to be some of the key things that we try to focus on today, trying to focus on the really important ones, the common ones, things that every embryologist should be aware of. So to really achieve high quality in the IVF lab and focus on quality control, it starts with having the right tools. And this has gotten a bit easier over the years through technology and development. There are more tools available to us, but we need to make sure we use those tools accurately and properly. That means making sure that those tools are calibrated and functioning using proper technique. So with any sort of new technology, you need to make sure that you become a bit of an engineer or a technician in the sense of making sure that you can troubleshoot that device and use it properly, digital versus analog sort of comparison there. And so in addition to getting those new tools, making sure that we have the training and the know-how to use them correctly. And then, as I mentioned, using them on a regular basis to measure, monitor, track, analyze, review, making sure that you understand what you're measuring, why you're measuring and reviewing. When you do this, somebody is reviewing that information, looking for acceptable thresholds or ranges. If a temperature or some other measurement is out of range, that people understand why it's out of range or what the range is. And then most importantly, that people are taking corrective action. And again, in a perfect world, the entire team is involved in this process. And that's not to say that you can't delegate the ultimate corrective action or review to a more senior level person. But everyone should be involved and be aware, because we know that there are weekend rotations, weekly rotations, staff change, and that really is part of the overall training and competency program in the lab, is for people to understand the quality aspect, not just the technical aspect of doing the physical embryology. So one of the first places to start when we're looking at quality control in the laboratory is making sure we're starting off with proper materials, consumables, contact items. And that starts with material testing and avoiding toxicity. So most of us are using items that have been pre-tested from commercial manufacturers, an immense improvement over a few decades ago when we were using non-IVF or non-embryo specific contact materials, and toxicity was a much larger concern. Many of our manufacturers do this initial pre-screening for us. And in many cases, you can use these pre-tested materials right out of the package and be able to culture your embryos. It's not necessarily a bad idea to do additional levels of testing. We do that in our laboratories because it's known through some recent recalls that are well known from major IVF commercial suppliers that there can still be some toxicity or quality concerns. So we add an extra level of that testing in our laboratories, even though it has been pre-tested by the manufacturer. But that testing involves some sort of bioassay in-house if you've got the time or capability to do that. It could be a mouse embryo assay. It could be even more strict, adding cell counts or using some other biomarker indicator of quality. Dean Morbeck and others have talked about using morphokinetics if you have time-lapse capabilities in your lab, and maybe that gets some insight into more subtle toxicity. You can also use human sperm survival or even some more molecular testing that some of these commercial suppliers use when they're testing things like oil or other sort of media. So important that we are making sure to the best of our ability that the items we're using are not toxic to set us up for success later on. So critical in that process is making sure that we're doing some sort of supply and lot tracking so that you understand what consumables are being used and And presumably they're on an approved list as part of an SOP so that your labs are all using the same materials, that you're not having some embryologists or patients being put in one dish or using one pipette while other patients are being treated with something completely different. That adds a pretty big variable that makes it difficult to troubleshoot if there is an issue down the road. So some sort of documentation or tracking system where you know which consumables are being used, that it's consistent throughout the lab, and that you know when a lot number changes to make sure that you're be able to track that sort of material testing and toxicity component throughout the IVF process. So the next sort of critical topic of quality control that every embryologist should know is really about pH. And certainly this is not a new topic. I think most people are familiar with pH, but it's good to reinforce, especially for those new embryologists or junior embryologists in the field. But pH is referred to PHE when you're talking about pH of the culture media. It's established primarily between the equilibrium between the incubator CO2 levels that we set and monitor and the bicarbonate and a few other ingredients inside the culture media. And so the equilibrium of those two factors primarily then result in an endpoint measurement known as pH. pH can impact embryo development. And in the lab, when you think about pH in a practical sense, it's convenient to think of it in three main phases. That phase where you put the dish or the media into the incubator and the pH has to equilibrate, normally coming down to your set point. That set point is something that you need to know in your laboratory. Embryos don't like to grow outside of a certain set point, usually someplace around 7.2 to 7.4, although most labs will set that a little bit narrower, maybe 7.25 to 7.35 to maintain and reduce that variability that we talked about. And that's something that is then measured and assessed because if it falls out of that range, you can have compromised embryo development. The other area of pH then is stabilization. So especially in those labs that don't use uninterrupted culture and are observing embryos outside the confines of the incubator, as you move those embryos in and out of the incubator, that pH can vary or oscillate because of the off-gassing of the CO2. And so that is why we work with specialized media or specialized conditions to try to stabilize that pH and avoid that variable and potentially compromising embryo development. So every embryologist should sort of understand the premise of pH, how it functions in the lab, and that will then set you up better to know how to avoid harmful pH changes or deviations. And so here's a couple real world examples of why it's important to measure pH as part of a quality control program. So here's an example on the left in the table of 5 different media. These were all HEEPS buffered HTF media. So HEEPS buffered HTF media, human tubule fluid, made for use outside of the incubator. And in most of our labs, we try to maintain temperature at 37 degrees for most of our processes. And so we were looking at a new media to save cost, to address some supply issues several years ago. And so we ordered 5 different HEEPS HTF media from some different commercial manufacturers. Now, they all had the same name. We weren't privy to their ingredient lists since most manufacturers now don't print their ingredient lists, but by the name, they were all the same, HEEPS HTF. So warming those up to 37 degrees in a incubator that was ungassed, we then did a pH measurement to see if they were coming into the range of our prior pH to make sure that things were within our set point and our acceptable thresholds. So media 1 through 3 fell within our acceptable range at the time, which is around 7.25 to 7.35. However, when we got to media 4 and 5, those were significantly lower. And this would have then put our embryos at risk, putting them into an environment that was outside the acceptable range established in our laboratory. And we never would have known that those media number 4 and number 5 were the improper pH unless we had measured it. On paper, they were all the same media, HEEPS buffered HTF, but in practice, there was something fundamentally different about them. So upon follow-up with the company, it was discovered that the company formulated their specific media for use at room temperature. This was not indicated anywhere on the documents. So they were not formulated for use at that 37 degrees where we had warmed our surfaces for these particular media. And so they then updated some of their paperwork. But again, without measuring, this would have been a problem and would have potentially created a damaging embryo culture environment. In a similar fashion, with bicarbonate buffered culture media, on the graph on the right, we were using a media from a commercial manufacturer where we were supplementing 10% SSS protein ourselves. We wanted to look at pre-supplemented protein media for convenience and safety. And so we ordered the exact same media from the exact same company, just having them pre-supplement the same amount of protein. And we measured pH when we received that side by side. And as expected, our current media number 1, was within our range of around 7.27 to 7.32 at the time. And our particular incubators at 6% CO2. When we put media number 2 in there, which on paper said it was the exact same media, the pH was out of range. And this was because of the dilution factor. That new media number 2, was not being diluted 10% by the protein. The commercial manufacturer was adding protein during the formulation process and then volumizing up to the final volume after the fact. So it wasn't getting essentially a 10% dilution of sodium bicarbonate and other components. So as a result, the media was perfectly fine. We just had to adjust the CO2 settings on our incubator to come back into our acceptable range. So again, if we would have just made that change based on this certificate of analysis and the documentation provided, we would have been putting embryos in a culture environment that was not recommended, at least under our protocols at that point in time. So here's another example. There are people who say, well, you don't have to measure pH. There are conditions where maybe you don't have to do that with pre-mixed tanks on some of these incubators. Measuring pH isn't always easy, and it can be expensive, and it can be time consuming, and it needs to be done accurately. It can also be inaccurate. But here's an example, again, why I would make the argument that there are numerous scenarios where pH needs to be measured. It doesn't need to necessarily be measured every day or every week, depending on your system, but at some point it needs to be measured. So here's a case where we had a benchtop incubator time lapse. It took a pre-mixed tank. So the pH shouldn't change because the CO2 doesn't change. So we hooked up the tank, and the tank certificate of analysis said that it was 6% CO2, which is what we had requested. When we hooked it up to this new incubator, the reading was indicating 7% CO2. We're like, well, that's strange. We measured pH, and the pH was at 7.1. We're like, well, that's a little low. And we thought perhaps the incubator hadn't been calibrated. It was a new incubator. Maybe we need to go back and recalibrate it. But the pH was telling us that wasn't the case. The pH was telling us that the CO2 is too high. That certificate of analysis seems off, or seems odd. So then we started looking at the tank, and you can see in the lower right, even though it's faded, the tank actually says that it's 7% CO2. So if we would have just gone on the certificate of analysis, like some people suggest, we actually would have been putting our embryos into an improper pH culture environment. So again, measuring pH, in this case, it was just one time, and you could make the argument that you only need to measure one time for this particular tank because the tank CO2 won't change. But initially, we needed to validate that that tank was giving us the pH that we wanted and actually was indeed the CO2 that was desired. And if you look at this, you can see analytical uncertainty of plus or minus 2%. That can have a significant impact, obviously, from these data on pH. So at least at some point, measuring pH makes sense. Now, again, I mentioned you don't have to measure pH every day. That can be problematic. In the US, there's a regulatory requirement for routine daily monitoring of pH or CO2. So it's more convenient, more time consuming, or less time consuming and less expensive to measure CO2. And this can sort of be a proxy for pH. And the nice thing is there's multiple CO2 and O2 measuring devices. A few of them can be seen here. I would say none of them are perfect. Some are a little bit better than others. Some handle humidity better than others if you're using humidified incubators. But the important thing is to use these daily, use them on every incubator, and make sure that they're calibrated. That doesn't mean necessarily that the readings on these digital displays are going to match exactly to your incubator, but you want to make sure you know that if there is a differentiation, what it is, and then you really look for trends on a daily basis. So if your incubator says it's 5.5% CO2, but your independent CO2 measuring device says 6% CO2, That's okay. If your pH is in range, that's fine. You just want to make sure that your daily measurements are coming out at 6% CO2 day after day, that you're not seeing any shift, anything to indicate there's a malfunction in the incubator. And if you know there's a 0.5% differential, that's fine. At a later point in time, you can go back and calibrate if you want your incubator to match up exactly to your CO2 measuring device, but that's not required. The requirement is to make sure that you are achieving the growth conditions and verifying incubator function. As mentioned, measuring pH at some point in time is prudent. Depending on your particular system, the amount of measurements and when you measure can vary. There's a variety of tools to measure pH. You can use a standard benchtop pH meter, very easy to use. Make sure it's calibrated, use temperature compensation. Can be used with test tubes of media and box incubators. Can be inexpensive and easy to do. A little bit more difficult to use in modern benchtop incubators, but there are several studies out there using and validating the use of blood gas analyzers. We use these in our laboratory. We do each incubator on a weekly basis to make sure that there hasn't been drift or any problems. And now there are even some real-time pH monitoring devices that will give you a readout over time to look at changes, which can be a useful quality control tool, as we'll discuss. And these are compatible with a few of the benchtop incubators. So the key is to make sure that you're measuring pH at least at some point at regular intervals, at a minimum on new lots of culture media that you're getting from manufacturers, at a minimum on new tanks of pre-mixed gas, due to the example we'd shown previously, and at a minimum after any sort of major incubator maintenance. And then if you do it more regularly, every week, every 2 weeks, you know, that's your prerogative, but that would be in addition to daily CO2 measurements, which is, at least in the US, a regulatory requirement. So I'd mentioned some of the potential benefits of these new real-time pH monitoring devices. And the key differentiator here from some of these manufacturers is monitoring versus measurement. Measurement in these cases sort of refers to a single measurement at a time point. Monitoring sort of strings these together and gives you a picture over time and helps paint a picture of some potential issues or room for improvement. So in this particular case, from Susan Olds and those commercial manufacturers of this particular real-time pH monitoring device, they gave some interesting insight into incubator management and how these incubators were used. You can see in the green a very flat pH line indicating that there was minimum use, minimum off-gassing, minimal changes in pH over time. So the embryos in this particular incubator would be happy in a nice stable pH environment. However, in the blue line, you can see that pH is increasing numerous times over those days, which coincides with door openings. And so depending on the number of these oscillations or door openings that you would have in a given period of time, you can see that the pH isn't as stable. And so it gives insight into incubator management. And so analysis of these sort of graphs could help a lab optimize use of their incubators and optimize incubator management. Spread patients out, reduce door openings, make sure that one incubator isn't being used more than another and potentially compromising embryos in that particular unit. As I mentioned, with any sort of new technology, including pH measurement, there are new devices. You want to make sure that those devices are accurate in giving you useful information in which to act on and not causing you to take actions that could be potentially detrimental. So there's several publications out there now looking at different types of pH measuring devices, validating them against some sort of current standard or control in the laboratory. So strongly recommend anytime you get a new piece of measuring equipment in your laboratory that you validate it against something to make sure you understand how it's functioning. And then it's giving you a similar readout to whatever you're using previously so that you're not causing issues. If you were using one sort of pH measuring device in the past and it was giving you a reading of 7.2 and your new device gives you a reading of 7.24, that doesn't mean go change all of your incubators. You need to make sure that those readings are accurate and determine which one is incorrect or not, and if there's some sort of offset, adjust your equipment accordingly. Don't use these equipment and then inadvertently change your lab settings to compromise embryo development. So another common endpoint that everyone is aware of in the laboratory is temperature. Proper temperature control is required to verify equipment function and proper culture conditions. And there are numerous pieces of equipment in our laboratory which are set up to maintain proper temperature. Now, that proper temperature, it can be debated. 37 degrees is what most people aim for, but you need to set an acceptable range. There's some interesting literature out there suggesting that perhaps slightly lower temperature may be more like what occurs inside the body, but currently achieving something close to 37 degrees is the standard of care in most IVF laboratories. But temperature in isolettes or manual or benchtop incubators, hoods with warm surfaces, warm stages on ICSI scopes, room temperature. These are all areas that we should be actively monitoring to make sure that they're achieving the desired temperature that we are trying to engage at that particular piece of equipment. Various procedural steps, various pieces of equipment. And the key is maintaining temperature can be difficult. This is something that we need to be very vigilant with and monitor routinely. And so this is nicely illustrated in this old paper, but I highly recommend everyone check this out. It really just indicates the number of variables that can impact temperature. So the key here is, in these temperature graphs on the bottom, that there are no flat lines, indicating that the temperature under these various conditions was never stable. It was changing due to something, and that could be the presence or absence of a lid, the amount of oil, presence or absence of oil, the size of the media in the dish, the type of incubator. Any number of variables can impact the temperature stability and temperature change. And so it's critical to understand what those variables are. And the way you do that is through proper monitoring and measurement. Here's another example. This is from some commercial media manufacturer websites looking at the warmed inserts that many of us have on our ICSI or biopsy inverted scopes. And you can see that different sort of warming stages can have different temperature stability on those inserts on the left. You can see that some are warmed throughout, presumably some sort of glass inserts, where some have cooler spots in the middle, some of those metal inserts or others where there's a hole cut in the middle for the microscope objective. So just a nice illustration using some newer technology of that temperature variance across the surface. And you can see the same holds true for dishes. Using some of that thermogenic imaging, different dishes have different rates of heat transfer based on how they're made. If the bottom of the dish is not in contact with that warm surface on which it's sitting, you can have some cooling effect. So there are certain dishes out there that have a different sort of surface that sits more flush or more in contact with your warm surface on a microscope or a warmed hood, for example. So again, numerous variables to consider when measuring temperature. And the key is to make sure that you are measuring and that you're measuring accurately to get an accurate temperature assessment to make sure that you can then adjust your equipment accordingly. That means using the proper devices that are properly calibrated, as mentioned, and different items or different procedural steps may require different methods. So you likely need to have several sorts of thermometers in your lab to measure the various things that need to be measured. There really is no one-size-fits-all solution for this. Measurements really need to be daily, at a minimum before use, and it really should be on every piece of equipment that has some sort of temperature regulation. Now, we mentioned that there's a variety of tools that really need to be employed. Here's just a small example. There are still some very fine, suitable analog approaches that can be useful. Very difficult then to track these. It would be manual on paper. We'll discuss some of that later. But there is a growing number of digital thermometers that can be useful. Some made inside dishes, which can be useful for benchtop incubators. You can see some of these thermocouples and other sort of probes made specifically for the smaller incubators that many of us are now using, or even just other digital displays, some with minimal maximal levels, some with data logging capability. But the nice thing is a variety of tools to meet the variety of measuring needs that we have in the IVF lab. This is a thermometer that I like to highlight that we've started using in some of our labs. And this particular one is referred to as the ThermoButton. You can find these online from a variety of manufacturers, but this is especially convenient in some of these small benchtop incubators. You can imagine if you have 10 or 12 chambers, it becomes very difficult to measure all those chambers every day. Some would say impossible, especially if you have 5, 6, 7, 8 of those. You would be constantly opening and closing the doors, and you'd have to leave your probes in there for several minutes at a minimum, if not longer, to get a stable temperature reading. and you don't want to be off-gassing or compromising the embryos inside. So this particular measuring device is convenient. It's the size of a small coin. You can put them in the chambers with patient embryos, and it data logs your temperature over time. So you can go in one time, pull that out, download the data, look for any temperature excursions. In theory, you could put one of these in every chamber and do that every day in every chamber, or you could rotate that. And you could put these on other devices. You could put them inside of a small dish under oil, put it on your ICSI stage, do surface measurement that way, or other pieces of equipment. So this has been a nice novel approach for us, rather than trying to tape down thermocouples or use some of these analog thermometers to measure temperature in the various systems in our lab. Another example, and it's nice with some of the advances in technology, is the new alarm systems that really every lab needs to have. Some of them come with independent temperature sensors. And so here's an example of some of these on an embryology freezer or on a cryo tank, extremely important. And so these now have data logging capability in terms of temperature. So not only will they alarm when something falls out of the acceptable range that you've set, but you can go back from a regulatory or quality control standpoint and look at that temperature as well. And again, you might find some interesting trends there to help you identify whether a piece of equipment is malfunctioning or is getting overused, and then you can take corrective action. So nice to see this sort of dual function. In addition to alarm, you can also get some temperature monitoring for your regular review and quality control. One of the final areas I'm going to talk about that every embryologist should understand and be aware of is evaporation and osmolality in the IVF lab. Evaporation of media can lead to alteration of the growth characteristics of that media and compromise embryo development. And so when it comes to evaporation, this really means osmolality increase. So as media evaporates, the solute concentration becomes higher. If you measure that with an osmometer, that'll be reflected as an increase in osmolality. We all know that osmolality impacts cell volume. You can see that most regularly when you send your oocytes or embryos through the various cryoprotectants that have higher osmolality. They shrink up. If you take it out of that osmolality too quickly, it'll re-expand too quickly and can damage the cell. But more subtle changes in osmolality can still impact cell volume and, importantly, embryo development. And so that's been shown over the years in mouse and other models. Jay Baltz has done the vast majority of work in that field. I highly recommend you read any work from him if you have an interest in osmolality. But we had showed this a few years as well, sort of recreating some of Jay's work. 300 milliosmolar is sort of the range where you start seeing compromised embryo development. But the point is, when your osmolality increases, you can have compromised outcomes. Now, importantly, from an embryologist and a quality control standpoint, certain procedures have an increased likelihood for changes in osmolality due to evaporation more than others. So specifically, extended retrievals, where you have dishes of media, many times without oil on top of them, on a warm surface in a hood, evaporation is occurring, and we'll show an example of that. Dish preparation of microdrops, specifically if you're in a busy lab doing multiple dishes, evaporation can occur here, and we'll show an example of that. And finally, and probably of most concern to many labs this day and age, uninterrupted embryo culture in a modern incubator. Most incubators now are dry, and if you're culturing embryos with no media change and minimal handling over now up to 7 or even 8 days, if you take into account the 24 hours of dish equilibration in these incubators prior to 7 days of embryo culture, evaporation can occur even under oil. And that was a relatively new discovery that's been validated by several labs over the last 5 or 6 years or so. So this is based on a paper from Gary Smith's lab that I was fortunate enough to be involved with at the University of Michigan now over a decade ago. And we did a very simple experiment. We were preparing microdrops in a hood under various conditions, and then measuring osmolality to see how much evaporation was taking place. And could we adjust our preparation conditions to optimize embryo development, or I guess more accurately, can we avoid using approaches that compromise embryo development by improperly making dishes? Let's make dishes better. So we looked at surface temperature, whether the air hood was on or off, different methods of preparing the microdrops, meaning putting a drop down one time and sort of covering it with oil versus putting a drop down, covering it with oil, removing that drop, and adding fresh media. More labor intensive, but that's the explanation of the standard versus wash approach. And then we looked at different sizes of microdrops. And the take-home point was that different conditions resulted in different rates or different amounts of evaporation. So surface temperature, microdrop, prep method, and drop volume all had a significant impact on the change in osmolality representing evaporation that took place. And under the best conditions, which was media right out of the bottle, which was in this particular media coming in right around 280 milliosmolar, versus the worst conditions, which was the smallest microdrop on a warm surface with air on in the hood using the standard method, there was a greater than 40 milliosmolar change. And importantly, that is well above that 300 milliosmolar threshold that I gave where embryo development starts getting compromised. Under the best conditions, there was a non-significant increase of around 5 to 8 milliosmolar. So this told us that something as simple as dish prep could actually set you up for failure or success in the laboratory in terms of your growth conditions. And so the take-home point here is this is seems like a relatively easy or benign task, often relegated to the most junior embryologist in the lab, and it really is not benign, and it really likely should not be assigned to an experienced junior embryologist. A junior embryologist should at least be made aware of the importance of this procedure to make sure that it's done properly. And that means minimizing the number of dishes that are being made at one time, making sure that you get oil over the top of those dishes properly, and making sure that you're using the right conditions wherever you're making those particular microdrop or culture dishes. We had mentioned extended retrievals as also being an area where evaporation took place. And so here's an example here on the left in the 4-well dish, and you can see condensation on the lid of that dish. And so in this particular lab, they were doing retrievals in a warm surface laminar airflow hood. And they had their 100 millimeter dishes of follicular fluid where they would identify the eggs, and then they would put them into this 4-well dish to hold the cumulus oocyte complexes. And they didn't put oil overlay on these dishes because they didn't like how the cumulus cells would attach to the oil and sometimes get caught in the interface or get oil droplets in the cumulus cells. It was problematic, especially because they did a lot of standard insemination at this particular time. But visually, you can see that after just 5 minutes on the surface, evaporation has occurred. So that media, osmolality, and other characteristics is not what it was out of the bottle. So this could be easily addressed. You could put oil on top of it. You could use perhaps a different sort of dish to address this. But the key is just 5 minutes resulted in some pretty significant evaporation under these particular conditions. And even though the cumulus oocyte complex is a sort of protected cell with those cumulus cells, it's unknown if this could have a negative impact. Certainly is not the media that the manufacturer sold us in terms of osmolality and other concentrations because of the evaporation. I mentioned uninterrupted culture is another area. We published on this a few years ago. Several others have validated this. But evaporation occurs over time in modern dry benchtop incubators. So in this particular experiment, we used 25 microliter drops of media in a standard 35 millimeter dish with 3 milliliters of oil over the top. And you can see that after 72 hours in the incubator, dry versus humid, that there was a significant change in osmolality, showing that evaporation was occurring in the dry incubator, even under oil. And at this point in time, we were using a paraffin mineral oil. And then that continued to increase over time to 168 hours. And at 168 hours, which would roughly be 6 days of culture if you include a equilibration timing on top of that, you can see that you achieve over that 300 milliosmolar rate. So the point is, you may not necessarily see dramatically reduced blastocyst development, but that media is not what it was out of the bottle. Fortunately, in this case, in contrast to that prior study I showed of microdrops, the media we used was more modern media with a starting osmolality of around 265 milliosmolar. So that evaporation took longer to get up to that 300 point. And so that's one of the take-home points of things that you can use in terms of osmolality and evaporation concerns is media selection. It might give you some wiggle room there in terms of the amount of evaporation that may be acceptable. So there's a number of tools we can use to help monitor evaporation and osmolality change. You can see a couple osmometers here. They can be expensive. They can be finicky in terms of their use. Most labs don't have osmometers, but they are available and they are a useful tool, especially if you're validating new systems. Manufacturers or colleagues at universities may have access to these. And if you get a new incubator, you could sample media, put it into a test tube, and have a colleague who does have access to an osmometer take some measurements for you if that seems necessary. You could also have any number of hygrometers to measure humidity if you're looking to maintain a certain humidity. Some of these are very small, can fit in small incubators or isolettes or in the room. So various tools at our disposal to make sure that we can maintain osmolality and humidity and try to avoid evaporation. Perhaps the best tool or the best consideration when it comes to evaporation and potential harmful changes in osmolality is being considerate of time. Obviously, the longer time something is exposed to conditions that promote evaporation, the more evaporation will be there. So minimizing the amount of time that your dishes or your media or your embryos are exposed to things that could cause evaporation would be prudent. And use of newer oil, heavy oils have been shown to help reduce evaporation more so than some of the thinner, lighter, or even just the paraffin oil. So oil with higher viscosity and density can be a useful tool in combating this. So sort of to put a finer point, a summary on evaporation and osmolality increase, being mindful of the type of incubator you're using, whether there's humidification or not, the dish type permitted. Some of the dishes are more or less prone to evaporation based on some of their geometries, specifically the surface area of the media being exposed. There are some embryo-specific dishes that cover the dishes on multiple sides where only the top is exposed. So that can minimize the surface area and minimize the evaporation that can occur. You can look at changing media at some point in time, refreshing versus uninterrupted culture. If you are having an evaporation issue, you can do a single media change on day 3. That's what we implemented in our lab to avoid this. And as mentioned, using or selecting a culture media that has a slightly lower osmolality, somewhere around 260 milliosmolar, so it can be useful. Adding more oil to your dish if possible, more oil over the top of that microdrop or media will reduce evaporation, as well as mentioned the type of oil. Using a heavy oil with an increased density or viscosity can be very useful. And these sort of topics were very nicely explored in a publication in Human Reproduction a few years ago in 2021 by Steve Mullins. I highly recommend you read that paper if you have an interest in sort of some of the modeling and mathematics and practical considerations between media evaporation and culture conditions. So we've talked about some of these endpoints that are critical for embryologists to understand, some tools that can be useful in measuring and how to measure and how to combat some of the changes that might occur. But as we mentioned earlier on, you really need to make sure you're measuring, tracking, monitoring regularly, and documenting. And so there are new tools to improve documentation, which in turn can help improve the consistency of those measurements or quality control. And this was nicely summarized in 2019 by David Gardner and Rusty Poole. So two giants in our field. Anytime you see a publication with these two gentlemen on it, it's sort of a must-read paper. And so they had an editorial on quality control in the IVF laboratory, talking about some of these new technologies that can help improve our monitoring approaches. Importantly, help us better detect some of those trends, changes, and variances to take that corrective action in a superior fashion. So if you have a spreadsheet on paper where you're looking at temperatures and you can see the temperature sort of in range, bouncing up and down, visually that doesn't really throw off any warning flags or alarms because you're in range. But if you graph this out and you see that starting to creep up over time, or you see some pattern, that might cause you to take a different corrective action and avoid some other issues. So the point is, moving away from paper to some of these digital platforms can help improve consistency and insight. And this can be done remotely. So this is also a nice thing when we talk about embryology shortages and workflow efficiencies, that you don't have to be on site every day as a director or a supervisor or whoever is sort of tasked on the team and this comprehensive approach of helping review this stuff. You can have somebody track this remotely as sort of a double check to make sure that things are being done properly and corrective actions are being explored. And that editorial is really in response to this really good paper from Giles Palmer and colleagues from RBM Online. Again, if you see a paper from Jacques Cohen or Giles Palmer, it really is sort of must read these days. But this was a review of sort of the use of this Reflections QC app. Importantly, they found major differences in how labs were monitoring instruments. Incubator monitoring clearly or obviously was the most common thing, but there were other instruments and there were differences in how people were monitoring these incubators. And there were different thresholds and different issues. And so, there was a sort of call for international standardization and guidelines to help us all improve, but a really insightful paper and just sort of the first indication of how useful these applications can be, especially if you're in a multi-site network or if you're trying to sort of compare yourself against others for a benchmark. These digital tools can be useful. And I'd mentioned sort of the improved ability to spot trends or consistencies or deviations in relation to just paper charts in the lab. And you can see here these graphical displays of temperature or pH over time. You can look for trends. If there was a shift here above the threshold or the mean, you can find reasons. So superior data control and tracking for regulatory purposes, but also for troubleshooting and active corrective action in the labs. And those are just a few key examples of over the 200 variables we mentioned in the lab that really every embryologist should know. And there's more to come. And so these are just a couple papers with AI, deep learning, new technology. There might be additional endpoints, additional tools for us to use that could help spot some of these trends faster than us, or identify things that maybe we haven't even thought of because we haven't had the tools or the data or the analytical capabilities to sort of do that with ease on a regular basis. And so as technology and specifically software, AI, and automation continues, I think we're going to see a continued improvement and change in the quality control that we do in the laboratory. It'd be nice if it becomes more automated, allow the embryologists to spend a little bit more time on embryology as well. So to sort of summarize, we must assess various endpoints in the lab to ensure quality. That means having the right tools to simplify and improve this process. And the nice thing is the tools that we have at our disposal have increased and have improved. Importantly, we must validate these tools prior to implementation in the lab and make sure we use them properly. Make sure you're measuring pH properly in a regular fashion. Make sure you're measuring temperature properly with the right tools. And most importantly, you must track regularly and you must react appropriately to these QC measures. And that really should entail all members of the embryology team. So with that, I'd like to conclude the talk and pass it back to our hosts and moderators and see if there's any questions that we can answer for the group.
Great. Thank you. Thank you very much, Dr. Jason. It was wonderful talk which you took us through. You actually, I think, answered a lot of questions which we suppose a lot of people would be having in their mind on with regards to how to prepare a dish, when to prepare a dish, what are the different effects of temperatures and oils and laminar flows being on or off. So I suppose the presentation in itself was basic so that people should understand, but also scientific, that it covers the requirement, it covers the understanding of all the people who are attending the session to know the importance of QA/QC. A very well drafted presentation. Thank you very much for making us walk through that. I'll definitely ask Sir to then take on the questions because we do already have some questions popping up in the chat boxes.
So by the time, Dr. Jason, you very well elaborated on what should be the actual size of the droplet. So just wanted to ask you intuitively, like what is the ideal droplet size if we want to go for spent culture media collection? So in that scenario, so different genetic labs, they have different opinions over that. So, but what is the ideal size and what is the actual timing? Whether droplet should be followed right from the day 0, or it is better to do group culture till day 3 and then later you can switch to droplet culture. So this question has 2 parts.
Yeah, so I think the answer is going to vary based on the conditions in the laboratory and then what is trying to be accomplished. So in our labs, we use a IVF specific embryo culture dish that sort of has a predefined volume. So our volume is about 30 microliters because that's how the dish is set up. So we use that to help reinforce consistency as well in drop size, because we don't like to use automated pipette men. We tend to have toxicity issues with the plastic tips. So we use glass pipettes, and we can do 30 micro drops, which fit perfectly into the dish that we use. We use group culture because of our system. We do a lot of PGTA. We group culture up until the blastocyst stage, at which point in time we then pull out individual blastocysts that are going to be biopsied and frozen individually. And so we believe in the benefits of group culture, sort of supporting the literature out there that's been out for decades that group culture is beneficial in human and in animal. That's not to say that individual culture can't be used, especially in some of the modern time-lapse dishes, but we don't have time-lapse. We don't use individual culture. We use group culture for our systems. And we use 30 microliters because of that group culture and because of the dish. Now, we do use dry benchtop incubation. We tried to use uninterrupted culture. We did not have optimal blast development with uninterrupted blast culture. We were looking at a balance between efficiency and time and cost and outcome, and we had the best outcome with a single change of media on day 3. So under our conditions of 30 microliter microdrops, 3.5 milliliters of heavy oil in our particular dish in a dry incubator at day 3 with a single media change, we had the best embryo development on day 5, day 6, and day 7 for our particular paradigm of PGTA. We don't do any media sampling. We don't do any NIPGTA or anything. So in terms of media sampling for analysis, our conditions have not been set up for that. So if that were your priority, you would have to use individual embryo culture. Usually slightly smaller volumes are recommended. I haven't validated any of those, but the papers I've read have been somewhere more in the 10, 20 microliter range because you're trying to concentrate those variables. And with a single embryo, you don't have to worry about depletion of factors. But if you're in a dry incubator, culturing in 10 microliters for several days, it's probably going to be problematic, right? In a humidified incubator, it's not so much. So it really is a difficult question to answer because it depends on what you're trying to measure and what conditions you're using. But what we have done and what everyone should do is validate your conditions to make sure you're getting the optimal development. And that can be done easily, retrospective or patient splits. If you want to look at a change or reduce volume or something, split 5 or 10 patients and see which conditions are giving you the best outcomes.
Right. So you generally recommend that 30 microliter is an optimal sample droplet size, and followed by day 3 change. That is crucial.
For our conditions, I would say that other labs, colleagues of mine who use time lapse or other conditions find that uninterrupted culture works better for them. So I certainly don't want to say that approach is going to be the best for everybody, but that's what worked best for us.
Okay, that's wonderful. Thank you for answering that. And maybe we can switch on to the questions from the chat box. And hi, Jason, this is Obi. And what would you say about increasing the temperature in the warming oven and equilibration incubators so as to maintain 37 degrees to 37.2 degrees temperature by the time the dish or tubes are brought to the work surface?
Yeah, so good question. My answer to this generally is that slightly lower on temperature is safer than slightly higher. Data suggests that embryos can grow under 36.5 degrees. They can even culture under 36.0 degrees. But the prior data shows that if you go too high, it can be problematic. And we know that things like fever, things like that in the body are damaging, right? So if you're going to err on the side of caution, it seems that slightly lower is better. So I would say setting your incubator to achieve 37 degrees in your media is prudent. We've never tried to achieve 37.2. If the concern is, as I move from the incubator to the surface, it's cooling off, my solution would be, we'll move closer to the working area. Move your incubator closer. Don't walk so far that it's cooling off. So we usually have an acceptable range of somewhere between 36.5 and 37 degrees. You know, the most critical portion of this particular question is likely when you're doing vitrification warming, you want your thaw solution to be at 37 degrees, right? So that's why they tell you have your media right next to your station in a warm oven or on a warm surface, plunge immediately. My concern would be if you had it at 37.2, that's high, and that may be too high if it doesn't cool off to 37. So I try to achieve as close to 37.0 as possible, airing slightly lower. So I wouldn't recommend trying to get to 37.2 personally. And if you're worried about cooling, I would adjust sort of the workflow or the layout to try to avoid that cooling occurring.
Great. So I think that's something which is a message for people, because generally people try to have this range of 36.8 to 37.2 as a range to manage the temperature of incubators. But you have clearly mentioned that you would not like to go towards 37.2 and be specific towards 37.0. And that's what everybody should try to achieve.
Yeah, and so the other thing to make note is that doesn't mean that the display on your incubator or warm surface might not read higher than 37 degrees, right? Because we know that calibrations aren't always perfect, and that's why temperature measurement is key. We have numerous pieces of equipment that read 37.2, but when we measure inside of it, it's at 36.8 or 36.9. If we measured inside and it was at 37.2, we would adjust the temperature down. We don't like to exceed 37.0.
Great. Thank you very much. It's a clear message that people try always to have 37.0 and not exceed 37.0 temperature for your culture conditions. Now, with regards to that, I think you also showed a dish with evaporation, a 4-well dish with the operation in your presentation. And of course, there is a question by guest Ayan Diktat mentioning that what might be the reasons for evaporation in 4-well dish and how to avoid such situations. You have actually answered it in the presentation, but maybe just crisply to have again the revision of the same.
Yeah, so the evaporation occurred because it was a warm surface for 37 degrees. There was no oil overlay, so anytime you warm something, right, evaporation can occur. In this particular instance, the bottom of the dish was warmed 37 degrees, so it's evaporating. The top of the dish was cool, so that's why it's condensing on the top of the dish. The nice thing is that lid was on top of the dish. If that lid wouldn't have been on top of the dish, you wouldn't have been able to visually observe the evaporation. It's still occurring, but because the lid was on, it cooled and condensed. Osmolality still changed, evaporation still occurred, but at least their workflow, they left the lid on top to try to avoid evaporation because the airflow of the hood would have increased evaporation by blowing across the top of the dish, or to avoid things falling into the dish. But in that particular instance, it also still nicely illustrated that evaporation was still occurring. So the solution would be to put oil over the top of those wells to avoid that evaporation. And that really would be the primary or best solution to avoiding that evaporation, because without oil, it's still going to evaporate. And without a lid, it's still evaporating. You're just not going to see that it's been evaporating.
Right. So use of oil and use of lid is something which is critical while preparing the dishes, and you should use them so as to avoid the evaporation. Because in your paper, you have clearly mentioned on that controversial scenario that one stress leads to another. It's a chain reaction. One changes, the second will change, the third will change, and the culture conditions will definitely be compromised. So
yeah,
that has to be taken care of. Right.
Thank
you very much.
And for us, from an equipment standpoint, we end up using humidified isolate chambers, workstations. Some people call them baby cradles or cradles in different parts of the world. We call them isolettes, where they're the humidified gassed chambers with the microscopes inside. And so that humidification, even though you only get up to 45, 50%, that also helps avoid or combat that evaporation.
Yes, I believe that in the Cairo consensus also with regards to air quality, though they have not recommended directly, but they have suggested the use of closed working chambers, basically the CADS, will improvise the culture conditions for you. So you can use that. Right. With regards to same, we have a question with then this preparation comes into picture over here, as we have already discussion on the effect of temperature on the dish preparation also. There's a question which mentions, is it necessary to turn the flow and temperature of laminar on when preparing the dishes for culture? I think it is one of the most basic culture which most of the junior embryologists do face, and they have query on this. And also, should we keep the flow of laminar on even if there is a fully functioning HVAC system on in the lab?
So great question. Right. So somebody paid a lot of money to have a laminar flow hood to create sterile, optimal conditions. So we always prepare our dishes with the laminar flow on. That sort of gives an extra level of safety. Even though we have very expensive centralized HVAC systems and we gown up, we wear masks and boots, there's still dirt and dust inside the lab on the floor. It's inevitable. And so if you're doing it on a benchtop, you are going to have an increased risk of contamination. So it's always best practice to prepare dishes inside a laminar flow hood. The evaporation of that alone isn't a concern because you can just minimize the number of dishes you're taking or modify your sort of dish preparation approach. I would not recommend doing it on a warm surface. The lab I came from only had one hood that was a warm surface, and it was laminar flow on. And so we were sort of getting a couple of those variables that we don't like to see. So all we did was put in a little platform to lift the dishes off of the warm surface. And so when we did dish prep, we prepped them off of the warm surface, and we limited it to 2 dishes at a time before we put oil on. So I think you can achieve that regardless of what sort of equipment you have, with just a little bit of a shift in your approach. But I would highly recommend making your dishes in a laminar flow hood whenever possible with the airflow on.
Okay, so laminar airflow on and the temperature off, and prepare it quickly and with the usage of oil and lid. I think that will sum up, right?
Yep, very good.
There's a small concern, like once the laminar is on, so doesn't it affect the evaporation rate? So it will enhance the evaporation rate a little bit probably. So
yeah, so that's one of the concerns. But again, if you can take corrective actions to mitigate that evaporation with the laminar flow on, it's much harder to take those same sort of actions to avoid contamination, right? So if you prepare it outside of the hood, to me, in our labs, the risk of contamination is a bigger concern to me than evaporation under our conditions in our lab. We minimize the number of dishes we prep. We've shown that with laminar flow on, with our sort of shortened preparation time, we're not seeing significant changes in evaporation. So if I were preparing 6, 7, 8 dishes at a time, might be a different answer. But when you're only preparing a couple at a time, laminar flow alone doesn't have a negative impact.
So now jumping over to the next question. So it is related to the quality of the analyzers. So different company CO2 analyzers give readings different. 0.5% of variation is there. So how to determine which is the correct reading, and how to rely on a particular brand, or what do you recommend on this?
Yeah, so it's a great question. I think most of us have struggled with this. I would say whatever you choose to use, make sure that it's functional. Make sure that you have good access to technical troubleshooting, replacement parts, things like that. So whether that's something from a biosensor or one of the Aztecs or the OKOs or whatever it is, the key is make sure that you're using it consistently. It gets difficult if you've got multiple units in your lab because you're getting multiple readings. So this is one where it's very nice if you're consistent with the device you're using, and you can have multiple of the same device. Make sure that they're calibrated and make sure you're using them properly. Make sure that you're using the same unit in a consistent fashion. So what we do is we set a timer for 3 minutes. So when we hook up our gas analyzer to our incubators, we sample for 3 minutes, and at 3 minutes we take the reading, because we know CO2 stabilizes pretty quick, oxygen takes longer. So one of the biggest variables is somebody may be in a rush and they'll say, oh, I don't have a good reading, because they don't want to wait for 3 minutes. They're trying to leave after 30 seconds. So using the same piece of equipment, making sure you're doing it for the same amount of time and that everyone's using it properly should help address some of that. You'll get drift over time, so that's why you can recalibrate. Many of these have a function where you can recalibrate to room air and some sort of standard. And then the key is to make sure that, slight variations are okay. That's why we have ranges. The key is to make sure you understand the trends over time. And so if one analyzer is measuring way lower than another, right, what you don't want to do is say, oh, this analyzer gives me a reading of 6.0. This one gives me a reading of 5.5, and then start changing incubators based on the 5.5. What you should do is go back and recalibrate both those units, get them both to 5.5 or 6.0, and then use them and then track over time. And part of that is minimizing the variance between the user and trying to make sure that you're not using different devices that are going to make that more difficult.
Okay. So you mean to say, like, so we should keep using these devices consistently, and minimum 3 minutes is the time which should be given before reaching to some consensus that the final reading, right?
That's what we do. That's what we do for low oxygen. So set a timer. You know, your incubators may stabilize or your device may stabilize sooner or later. 3 minutes is what works for our particular system. Yep.
3 minutes is the minimum time. And on to that, the best practice is to keep them calibrated by the third party or by some external source. That is also
Correct.
one of the key points.
That brings me to one question, and that which again a lot of embryologists do face frequently. You have your analyzer, though the third party may also have the same analyzer. They come for AMC after every 3 months, but whenever they come and they check, they find there is a difference. In our analyzer, there is no difference. It's been working as it is, and the culture is giving me good blast rate, good blast rate, where I think there's no need to change, but the engineer shows that there is a change. In such situations, yeah, what should be done?
Exactly. So the key is you need to make sure that their analyzer is calibrated too, right? We've had the same thing where like we that's why if we can do calibrations ourselves on certain things, we calibrate them ourselves. Because if you have a rep come in who's using an uncalibrated analyzer, well, now he's just messed up your analyzer, right? So
Right.
very good point.
Yeah, so the message to the embryologists is not only to look after your performance, you should also know some of the instrumentation so that you do your own troubleshooting, not only depend on the third party engineer and the maintenance.
Exactly.
Right. So one of the questions which also there is in the chat is, as a scientific director responsible for multiple labs, what are your top 5 KPIs that you monitor at your level to get a fair bit of idea of lab health and outcomes?
Yeah. So, you know, I didn't really talk about it in these slides, but I initially look at outcome KPIs. So I look at blast development rates is one of the first things I look at. And we look at day 5, good quality specifically, and then total good quality specifically, and then total blast. So we want to make sure that between labs that they're all growing embryos in a similar fashion at an appropriate threshold. And then looking at total blast sort of gives us some insight into our embryologists being too strict in their grading. You know, if everyone's growing 70 or 80% blastocysts, but one lab's freezing 20%, the other lab's freezing 40% on day 5, you know, hey, what's going on here? Why are they growing bad blastocysts, or are they just grading too strict? So we're actually working with some AI companies to try to standardize that grading component. But I look at blast rates. I look at ICSI rates from a more technical standpoint. And then we have a new alarm system where we can sort of remote in. So for practical purposes, we tend to look at cryotank, not from a quality standpoint, more from a safety standpoint, because legally, if a cryotank goes down, so it's almost like we're checking those as a spot check to make sure that everyone's tanks are functioning. Incubators, because we know they're checking those every day, you know, we trust the embryologists and the lab leads to sort of be on top of that. But we can remote in and look at some of the temperature or alarm settings on the incubators too. But I look at outcomes, blast conversion, FERT rates. I look at some other ones. We break it down by patient age to make sure that we understand. We look at clinical pregnancy initially because we can identify that quickly. Chemical pregnancy, because we can identify that quickly and not have to wait extended periods to identify a clinical pregnancy or an implantation rate. So on every month, I look at blast development, chemical pregnancy rates, fertilization rates, egg maturity, things to help determine the success of the lab. And then the on-site lab staff really are sort of looking at the things we discussed today, the bench-side embryologist, so to speak. If some of those outcome measures are out of range, I can then sort of remote in or talk to the on-site team and start asking those questions about pH, about temperature, The nice thing is if you can remote in, you can look at some of those trends yourself or see if something was missed. If I can't identify something there, well, then we get on a plane, we fly, or we send somebody to that location who then says, okay, has anything here drifted versus our other labs? Are they using some new supply? Is there a new doctor? Is there something going on? So there's multiple tools, but because I didn't mention it in these slides, looking at endpoints, specifically blast conversion, is some of the first things we look at to see if there might be an issue.
Right. So blast conversion, good quality blastocysts, day 5 blastocysts are some of the ones which are the lab related ones which you definitely check across. And then is the egg maturity, ICSI rate, and along with that filters of patient age and then biochemical clinical pregnancies. So these are the ones which you generally monitor on a monthly basis. And then accordingly look after, compare between the two labs. And then you can catch hold of one doing better, compare it with the ones which are not achieving them, and try to take them with the ones who are doing good.
Correct.
Great. So going further, we have a couple of questions regarding to air bubble formation, right? There's one which I can see that non-humidified culture, how to reduce air bubbles. So at times the pipetting is good, the technique was perfect, but still you find after some time there are air bubbles in the droplets at the base of the dish. So what are the reasons and how to avoid these bubbles?
Yeah, great question. I don't know the reason. Perhaps some sort of off gassing from the plasticware itself, if there's some sort of air trapped in there, or I've heard another sort of theory put forward that you may not be able to see them when you put your media in there, sort of micro bubbles that then kind of coalesce into a bigger bubble after some jostling in the dish. We don't view them as an issue. And I don't know that they're specific to dry incubation. I've never sort of heard that connection. Maybe there is some connection, but for us, because we use GPS dishes, we don't use time-lapse dishes that are smaller. Air bubbles are very easy for us to deal with. We don't even think about it. We just take our stripper tip and we touch them and they float to the top and they go away. So it's not something that we've ever really been concerned about under our conditions. I understand that they're more problematic and more time consuming when you're in sort of a time-lapse dish because you won't be able to see the embryo and it might be harder to get them out. But I'm not aware of any way to avoid them completely because I'm not entirely sure what drives them. It's just a phenomenon that we see sometimes more than others, and we just address it by removing the air bubble.
Okay, so the take home is that the small bubbles, they should not bother anyone. And anyways, if they are there, they won't hamper the culture condition. So the culture condition, it remains the same, right?
Correct. That's how we view them. Yes.
Right.
Great. I suppose we have a lot of questions, and maybe we'll have to pick some of them, and then maybe possible reach out to him, have other questions maybe on mail and get answered. But we'll try to pick up the best amongst. And one of the questions is on oocyte stress, which we know because you have to put across a lot of attention on day 0 to pick up because oocyte is under the stress. And the question reads, how do you distinguish that the oocyte is healthy or oocyte is under stress when it is received in laboratory? Is there any basis or any methods, or you can just be precautious of it?
Yeah, great question. I think that's what we've all struggled with for years, right? Like the egg, it's the enigmatic egg. Eggs look good or they look bad. That can be difficult to understand what that means. So I think most people would say, okay, I know when an egg looks bad. It's got vacuoles, it's dark, it's small, but some good eggs don't do well, right? That's the issue is you can't always tell. So, my best answer to this is perhaps AI can help us, right? So there are new AI platforms out there that are starting to look at egg quality. I'm still sort of on the fence in terms of their usefulness because it may give you some insight into the egg, but it's very difficult for it to pick up the impact of the sperm, the technique, the culture conditions. But I think we're getting some tools to help us with that. But that's been one of the tougher questions to answer over the years. Like why do some eggs do well and others not when they look the same? The ones that look bad, those are easy. So it's a great question. I don't have a better answer, unfortunately.
So we don't know what are the stress oocytes. Possibly the AI may help by putting in data, and if it is really that it is machine learning neural networks to improvise in the future to give us those outcomes. But as of now, we do not have direct answer to that. And the
Correct.
tussle between the embryologist and doctor remains. Embryologist will always say they are bad oocytes, and doctors will always say, "Oh, I have given you good oocytes. So just give me outcome."
Yeah, all we can do in the lab is make sure that we're giving them culture conditions, right? We're minimizing stress. We're not being overly forceful with them when we're removing cumulus cells, that we're monitoring incubation conditions. You know, people will talk about stimulation protocols. You know, some of these patients are infertile, right? They may just have bad eggs. And so you want to do the normal things, make sure that the aspiration pump is at the right pressure, make sure the physicians are using similar retrieval technique, not giving you a whole bunch of immature eggs. Presumably somebody is sort of monitoring the stimulation, make sure that they're stimulating properly. But inside the lab, you know, all we can do is sort of provide stable culture conditions and just make sure that we're handling the eggs with care. And other than that, you know, yeah, maybe we can get some AI or other tools to help identify good eggs from bad eggs and maybe connect some more dots as to what might be really what we're trying to avoid, right? Are good eggs being made bad eggs? That's what we're trying to avoid.
Another very interesting question, which many people or embryologists as well as clinicians who are curious to listen to the answer is that regarding the number of embryologists in a particular lab. So how many embryologists should be allowed in a particular lab? So in this, there is a typical example that we have a small lab of 18 into 10 feet. How many people should remain inside the lab and for optimal conditions?
Yeah, so you know, it's a great question. I tend to think staffing requirements based on volume of patients and cases. I tend not to think of it in terms of square footage, but it's certainly a variable. So the publications say usually around one embryologist per 150 to 200 retrievals. Alpha, I think, even goes down to lower than that, 1 to 100. But the issue is all procedures aren't the same, right? If you're in a lab that's doing day 3 culture versus day 5, doing a lot of biopsy versus not doing a lot of biopsy. So I think the key is to have a standard based on caseload or volume. And then presumably the size of the lab has to coincide with that volume, right? Like if you have an 8x12 lab, you probably can't be doing 1,500 retrievals, right? The lab's not big enough. You don't have enough incubators. So that's not always going to be the case. I understand some small labs might, you know, be over capacity and be putting, you know, 24 patients into an incubator that's meant for 12. But physically, if you're asking how many embryologists in a space, not so many that you're bumping into each other, right? And so, but normally a minimum requirement is at least 2 people in the lab at any given time for identification purposes and workflow. Our labs, we rarely have less than 3 people. And that's usually on a weekend because we have minimal staff. But on most days, we have 4, 5, 6 embryologists. Our labs are much larger. They're usually 800 to 1,000 square feet. But our staffing is based on the volume of patients putting through. Our internal standard is around 150 retrievals per embryologist, but that's a sliding scale that increases over time. As we get larger, we get more efficient. So then it becomes more like 1 embryologist for every 200 retrievals. And that's based on our biopsy heavy, vitrification heavy, FET heavy paradigm. So I think it's a combination of effects. You need to be safe. Certainly, I would never advocate for having only 1 person in a lab at any given time. Hopefully the labs are big enough to accommodate at least 2 people. And hopefully the volumes are such that you can have the right number of embryologists and the right number of incubators and other equipment to handle that volume.
Right. So your take is that it is not, the more important is that it depends on the number of cases which a particular lab is performing, and without bumping into each other, you can manage around 150 to 200 cases per embryologist. So that should be the criteria. And secondly, at least 2 embryologists is a must, because second one would be the witness to the first. Whatever.
Correct. Even we have witnessing systems, even with witnessing systems, it's nice to have a second person because things happen, right? What if somebody fell down? What if somebody passed out, right? It's good to have a second person there just to help. Even just recommendations as an additional witness in case the witnessing system goes down. So minimum of 2 people.
We had a
basic question with regards to pH monitoring, pH being one of your strong domains. And we know that there are now real-time monitoring systems, which you also have mentioned in your presentation, that we can implement those if possible. And the question is it really feasible to measure pH uninterruptedly? And is it that we do require monitoring of pH? Because a lot of them do indirect ones by measuring the CO2 by the CO2 analyzers, and not all labs have pH meter. So is it that you can keep that as the primary domain, or is it mandatory to do the pH, uninterrupted pH reading that?
Yeah, so it's not mandated. Uninterrupted monitoring is difficult. There's one commercial device that, there's a couple of commercial devices, but one primary that we've tested and other people use. And it's not inexpensive, but it's obtainable. So we don't do the monitoring. We do static once a week measurements. We like the pH. It's not required, but we feel it's best practice based on our prior experiences. And so what's required, at least in the US, is the daily monitoring of CO2 or pH. Daily pH measurements becomes a bit problematic, so that's why we do the daily CO2. So pH definitely is not required, but at some point in time, it's prudent because it'll give you insight. Otherwise, how do you know that your CO2 concentration is correct? It's not just because the person across the street uses 6%. That's if you use a different media or you have a different incubator that's not calibrated, that 6% could be giving you a completely different pH. So at some point in time, whether it's, like I said, once a month, once a week with dish change or with a media change, with a tank change, it makes sense to further validate your systems.
And you would recommend blood gas analyzer in that case? Or pH
so we do because of our benchtop incubators. If we didn't have benchtop incubators, I'd still be using a benchtop pH meter for our box incubator.